Today, we're diving into something really important, the state of mental health in India. We're going to be using a deep dive review from the journal Curious to really unpack the scale of this challenge and, more importantly, the path being carved out for a better future. So let's just start with one number because it's pretty staggering. 15%. That's roughly how many people in India are thought to be grappling with some kind of mental health issue. We're talking about millions and millions of people from every walk of life. It's a huge number to wrap your head around. And that really sets the stage for our first topic, understanding the sheer scale of this. Because this isn't just about individual stories. As important as they are, it's a massive, nationwide public health challenge with some really deep consequences. So when we say 15%, what are we actually talking about? Well, it covers a whole spectrum of conditions. You've got depression, that persistent feeling of sadness, all kinds of anxiety disorders, bipolar disorder with its dramatic shifts in mood and energy, schizophrenia, which can affect a person's grasp on reality, and of course, substance use disorders. Look, these aren't just clinical terms, right? They are the daily reality for so many people. And the fallout from this, it's like a ripple effect. It starts with the intense personal suffering, obviously, and how it can make just getting through the day a challenge. But then it fans out, creating huge societal costs. We're talking lost productivity, massive healthcare bills, and just an incredible strain on families and communities who are trying to support their loved ones. Okay, so if this problem is so big and affects so many people, you've got to ask, why is getting help so incredibly hard? Let's dig into some of the biggest barriers that keep proper care just out of reach for way too many. The first one is a big one, maybe the biggest: societal stigma. The source material really drives home how deep-rooted misconceptions and, just plain fear create this powerful culture of silence. People are so afraid of being judged or even rejected by their own families, friends, or at work that they often suffer in total silence instead of looking for help. And gender plays a huge role here too. The research is pretty clear that women in India often face a unique set of challenges that can make them more vulnerable. We're talking about things like domestic violence or these intense societal pressures around marriage and family, and all of that can lead to much higher rates of anxiety and depression. Then there's poverty. It's another critical piece of this puzzle. Think about it. It's like a vicious cycle, right? The constant stress of unstable living conditions and not having enough resources absolutely heightens psychological distress. And at the same time, if you're struggling with a mental health condition, holding down a job can feel impossible, which just pushes you deeper into financial hardship. And then, layered on top of all of that, you have the systemic problems, what the research calls the access gap. First, there's a severe shortage of trained mental health professionals, especially once you get outside of the big cities. The infrastructure often just isn't there. And critically, mental health care isn't really baked into the primary healthcare system. It's treated like an afterthought, not a core part of a person's overall health. To really get where things are going, you have to understand where they've been. So let's take a quick look back at the history of mental asylums in India, because they played a huge role in shaping the country's whole approach to care for a very long time. And what you see is this really slow evolution. It all starts way back in 1745 in Calcutta. The first asylum was all about what they called custodial care, which basically just meant separating people from the rest of society. It took until the mid-1800s for things to start shifting with the idea of moral treatment, which at least tried to be more humane. Fast forward to the 20th century, and that's when you finally see a more scientific approach with the rise of psychiatric research. And this slide, it really lays out the two completely different philosophies. On one side, you have that old model of custodial care. It was all about confinement, segregation, managing people. But on the other side, you have the modern goal, a therapeutic approach. And that is all about humane treatment, rehabilitation, and this is key, getting people back into society. It's a total 180. But that old model, boy, did it have problems. For one, the asylums often made the stigma and social isolation even worse. There were constant human rights concerns, overcrowding, no privacy, things like that. The quality of care you got was a total lottery, and there was a massive over-reliance on just medicating people without giving them the psychosocial support they actually needed. These critiques are exactly why a change was so desperately needed. Okay, so that's the past. Now let's talk about the present and the future. How is India trying to forge a totally new path forward for mental health care? Let's get into the modern strategies that are trying to reshape the entire system. A huge piece of this new puzzle is the Mental Health Care Act of 2017. And this thing is a game changer. It's landmark legislation. It completely shifts the focus to prioritizing the rights and dignity of individuals. Crucially, it decriminalizes suicide, and it champions community-based care instead of just locking people away in institutions. This is the legal foundation for a much more humane system. So a law is great, but how do you make it a reality? Well, through a roadmap just like this one. It's a really comprehensive plan that attacks the problem from pretty much every angle. Step 1, you've got to tackle that access gap by training more professionals. Step 2, you bring the care closer to home by decentralizing it. 3, you finally integrate mental health into primary care. 4, you get smart and use technology. And 5, and this is so important, you fight stigma by getting the whole community involved. In this quote from the research, it just sums up the whole new philosophy perfectly, doesn't it? The focus is shifting. It's all about community-based care, moving away from big institutions, and making mental health a normal part of mainstream healthcare. At the end of the day, it's not about building bigger hospitals. It's about building stronger, more supportive communities. Which really leaves us with the big question, doesn't it? The roadmap is there, the laws are in place, but with a challenge on this epic scale, can India actually pull off this massive transformation for the well-being of millions? It's a huge mountain to climb. But for the first time, it feels like there's a clear map to the summit.